Today in this lecture, we will talk about regulation of peritubular capillary physical forces or regulation of physical forces that are present in the peritubular capillaries. We have discussed in detail previously that the two main important forces present in the peritubular capillaries are the hydrostatic pressure and the oncotic pressure. Now, let us go into a little bit detail, and we have discussed this thing previously, that initially the fluid comes to the nephrons, and the filtration, first of all, filtration occurs in the glomerulus, and then the filtrate moves into the renal tubules, and the second step is reabsorption. This reabsorption from the nephron tubules through the interstitium into the peritubular capillaries is influenced by certain forces. Now, in our last lecture, we talked about the forces present in the peritubular capillary. This is the peritubular capillary as shown here. This is the peritubular capillary, which has been shown here in this diagram. Here we have the nephron tubule. So the nephron tubule has been shown, and this is the interstitial spaces. This is basically the interstitial space, and there are certain forces which are helping in the reabsorption of fluid from the renal tubule through the interstitium into the peritubular capillaries, and we are discussing the regulation of those forces which are present in the peritubular capillaries. So the first force is the hydrostatic pressure. The hydrostatic pressure is influenced by two main factors. One is the arterial pressure. If the arterial pressure increases, this hydrostatic pressure in the peritubular capillary will increase. It will increase. When this pressure increases, it opposes reabsorption. It means when the pressure, the arterial pressure in this area increases, or in this area increases, there is a high pressure, so reabsorption from the tubule into the peritubular capillaries become difficult. Now this thing is most of the time countered by counter mechanisms. There are some buffer mechanisms which try to maintain a normal pressure in the peritubular capillaries. Secondly, the hydrostatic pressure in the peritubular capillaries is also influenced by the resistance in the afferent or the efferent arteriole. Now see, here we have the glomerulus. This is the glomerulus, but this glomerulus is basically made of afferent arteriole and efferent arteriole. Now if the resistance at this point or this point increases, then if the resistance at these points increases, then the hydrostatic pressure in the peritubular capillary falls. Hydrostatic pressure in the peritubular capillary falls due to increase in resistance. There is less pressure. When the pressure decreases, it helps the reabsorption. So we see that there are different factors which will either oppose the reabsorption process, or which will either help the reabsorption or increase the reabsorption process. So increase or decrease in the arterial pressure may increase or decrease the hydrostatic pressure in the peritubular capillary, which may help increase or decrease the reabsorption process. Similarly, the increase or decrease in the resistance at the afferent or efferent arterioles will decrease or increase the hydrostatic pressure, which in turn will again increase or decrease the reabsorption process from the renal interstitium into the peritubular capillaries. So for example, if pressure in the afferent or the efferent arteriole has increased, then the hydrostatic pressure in the peritubular capillary will decrease, and the reabsorption from this area into this area will increase. Now this is one pressure, the hydrostatic pressure. This is the hydrostatic pressure. The second factor, the second force which helps the reabsorption is the oncotic force. The oncotic, the colloid osmotic pressure. Now the colloid osmotic pressure is also is basically dependent upon the amount of proteins in the peritubular capillaries. So any factor which will increase the amount of proteins in the peritubular capillary, factors which will increase proteins in these peritubular capillaries will help in the reabsorption process. So first of all, any increase in the systemic plasma colloid osmotic pressure, when there is in general increase in the level of proteins in the systemic blood, in the systemic circulation, it will definitely lead to increase colloid osmotic pressure in the peritubular capillaries, and this pressure will help attract the reabsorption, because increase in colloid osmotic pressure helps increase in reabsorption. And the second thing which will increase the colloid osmotic pressure in the peritubular capillaries is the filtration fraction. So filtration fraction simply means the amount of fluid that is filtered here. If the filtration fraction increases here, the concentration of protein in this area and this area will increase, and it will lead to increase in colloid osmotic pressure, which will further increase the reabsorption process. Now how the filtration fraction will increase? So the filtration fraction is dependent upon the GFR by renal plasma flow. So either the GFR has to increase or the renal plasma flow has to decrease. Either the GFR, the glomerular filtration rate, has to increase or the plasma flow has to decrease. It will increase the filtration fraction, and when the filtration fraction increases, the colloid osmotic pressure here will increase and the reabsorption will increase, and the reverse is also true. Finally, another factor which helps in the reabsorption is the filtration coefficient, the capillary filtration coefficient. Now we discussed previously that the reabsorption process is dependent upon filtration coefficient into net reabsorptive forces. Now net reabsorptive forces comes from the summation or addition and subtraction of these four forces: hydrostatic pressure and colloid osmotic pressure in the peritubular capillaries, and hydrostatic pressure and colloid osmotic pressure in the interstitium. This filtration coefficient Kf comes from the permeability and surface area. So this factor most of the time is constant. The permeability of the peritubular capillaries and the area of the peritubular capillaries most of the time remain constant. So it helps, although this factor helps in the reabsorption process, but this factor most of the time remain constant. So this will not be very much helpful in the regulation of the reabsorption process. Now why is it important to discuss the factors which influence the regulation? Because the reabsorption is an important step. Reabsorption of fluid from the tubule, reabsorption from the tubule into the peritubular capillaries is an important step in the urine formation, and we are discussing the urine formation process in detail. We are analyzing each and every step, so it is important to dissect it deeply and discuss each and every factor, each and every force which may increase or decrease filtration or reabsorption, and finally have some effect on the urine formation process. Thanks a lot for watching the video.